People are talking about brothers and uncles and family members that had multiple people in the same family that had prostate cancer. What role does family history play?
Well, family history is true of all races, right? So it doesn't matter whether you're black or white or whatever. If you have a brother or a father or your grandfather, the closer people are to you, if you have an identical twin, your risk is really high, right? If you have a brother who gets prostate cancer, especially at an early age, then your risk. So it's as high as like 7 times higher than it ought to be, in terms of if you, so family history is important, but most people that are diagnosed with prostate cancer don't have a family history. So if you do have a family history, you're at higher risk, but the lifetime risk of a black man being diagnosed with prostate cancer is somewhere between 1 in 5 and 1 in 7. So let's just say 1 in 6.
Okay.
And most of that cannot be explained by my brother had it, or my father had it, or whatever. It's just common. In fact, if you live long enough, you're likely to get prostate cancer. So if you see an 80-year-old man walking down the street eating a tuna fish sandwich, and you say to him, I bet you if I do a biopsy on your prostate, we're going to find a little bit of prostate cancer, you're about 75% right that there could be a small, little, tiny focus of prostate cancer. But
what questions should they be asking their doctor?
You should ask for a PSA. Some of the guidelines say that some of the guidelines don't recommend PSA screening. Some doctors follow those guidelines. And at Kaiser, I believe they stopped screening. Their policy is to stop screening at either 65 or 70. Okay. So they won't even tell you that they stop screening. They just will stop screening. So let's say that you're, and I know of a patient that, his PSA was slowly going up, and then he reached a certain age and they stopped screening him. And subsequently he was found to have significant prostate cancer. So you should be proactive. I think that you should be screened. It doesn't mean you should be treated if you get diagnosed as having low risk disease. You might want to do active surveillance. But I do recommend that black men get screened for prostate cancer.
Okay.
So the main take-home message is when you go see your primary care doctor, don't ask him whether he thinks you should be screened. Tell him, I've been watching, I've been listening to things. I would like to be screened for prostate cancer, period. The other thing is that nowadays people have access to their own electronic medical record. So you should learn how to get into your own chart. And if you learn how to get into your own chart, then you can look back over your PSAs that you've had over the last 10 years, and you can look and see if there's a pattern. Trying to ask somebody to remember what their PSA was 2 or 3 years ago is a little bit much to ask. But if you can look into your electronic medical record, then you can keep track of your PSA, your cholesterol, all kinds of things.